Theory of Interpersonal Communication, Nonverbal Communication, Chapter 6, page 268, assignment number 3 by Aaron Fahim. In addition to words, we communicate non-verbally. The first section of nonverbal communication is kinesis. Kinesis is the study of body position and motion. Types of nonverbal communication. Kinesis cover body orientation, posture, gesture, facial expression, as well as eye movement. Body orientation. The degree to face someone during conversation. When you face someone direct, it signals that you are interested and attentive. Whereas when you are looking away, signals that you are bored or simply not interested. By observing someone's body orientation, you can learn how someone feels. For instance, when you see in this picture, these two people having a proper body orientation, they face each other, so it seems that they are having a very interesting conversation. Posture is another way of communicating nonverbally. Posture is the way an individual carry himself or herself, or show his or her feelings through their posture. For instance, as we can see in this picture, what is a student's posture in a class? Are they interested in the class material? Are they bored and not interested? Are they involved in their own conversation? Or are they involved with yourself? Tension. Tension is a postural key that expresses feelings. It is important to observe if someone is tense or relaxed. Healthcare professionals need to understand their patient's feeling and try to calm them down before, during, and after the treatments. Relaxation. The second postural key to release tension, anxiety, stress, or anger and maintain calmness. Healthcare professionals should consider their patient's relaxation posture and relax their patients before starting treatment. Vulnerability is another important postural key to observe people's feeling. Vulnerability posture enables healthcare professionals to prioritize their patients regarding their illness vulnerability.
Gestures are woven into fabric of our daily lives. We wave, point, beckon, and use our hand when we are arguing or speaking. We animatedly express ourselves with gestures often without thinking. Gestural meaning can be explained differently across different cultures or religions. It is important to be careful to avoid misinterpretation of different gestures. Facial expression. The human face is extremely expressive, give you capability to express countless emotions universally. Explain happiness, sadness, anger, surprise, fear, and disgust are the same across cultures. Eye movements, very important type of non-verbal communication. The way we look at someone can communicate many things, like interest, affection, hostility, or attraction. It is also important to maintain the flow of conversation.
In conclusion, nonverbal communication is an important element of communication, which is not only useful for healthcare professionals, but also for everyday communications. Different elements of nonverbal communication, such as body orientation, posture, gesture, and eye movement should be consider during communication in order to have an interesting communication.